Hey everybody, Dr. Brandon Lee here. I'm the founder of Immune Strong Families. I had this great conversation with someone just last week about their vitamin D level results, and I want to talk to you about what happens if your vitamin D level seems too high, okay? So I had this great conversation. This lady, she handed me over her printed lab results, and her vitamin D level was 71 nanograms per milliliter, okay? Now, for reference, here at Immune Strong Families, we advocate for the well-documented and well-supported and well-researched idea that the optimal level is 40 to 60 nanograms per milliliter, okay? So you'll notice 71 is definitely above that optimal range. Now, personally, I have had a vitamin D level of 72, 64, 58. Like I hover at or above the optimal range, and I love it that way. So this lady, as she handed me her vitamin D results and said that it was 71, she had this kind of sense of concern or worry because her doctor had told her that she was too high. And so now she's worried that her vitamin D level is dangerous or something. And so I really want to add some context here, okay? A couple things to consider is most family physicians, most doctors have no education about nutrition and have done no additional learning or reading or training on vitamin D. They simply look at the test result and compare the number to the reference range that the lab results give, okay? And these reference ranges are really outdated. They're from established back in the 80s, like they're 40, 50 years old. And okay, so that's one thing to consider, okay? Another thing to consider is that the established level that is considered toxic is 150 nanograms per milliliter. Okay, so you'll notice 71 is not even half of 150. So this person is at 71, even though it's above the optimal range of 40 to 60, is nowhere near levels that are considered toxic. Another very interesting thing is if you know any functional medicine doctors, you can verify this with them. But my friends and colleagues that are work in functional medicine, they actually, for their autoimmune patients, they actually try to get their vitamin D levels up into 90 or 100. Okay. Another thing to consider is that this is feedback, and finding out that you have if you were to find out that you have a vitamin D level of 71, this would actually be really encouraging feedback, because now you know that your vitamin D strategy, which is your combination of lifestyle factors like sunshine exposure, healthy diet, vitamin D supplementation, you know that your vitamin D strategy is actually working to create blood levels of vitamin D, okay? And you know what? If you know what it takes to get a blood level of 71 nanograms per milliliter, and you are concerned that that's too high, it will not be that hard to tweak your vitamin D strategy and actually bring it down, okay? So we advocate for a vitamin D level of 40 to 60. But if you're working your vitamin D strategy, you're taking your supplement, you're spending time in the sun, and you end up being above that range by just a little bit, it really is not a reason to be concerned or to panic or to worry. And as a closing thought, the average American across all demographics has a vitamin D level of about 25 or 26, okay, which is still half of the optimal range of 40 to 60. I would much rather have a nation of people who have a vitamin D level above the optimal range at, let's say, 71 or 72 than to have a nation full of people who have a vitamin D level of 25 or lower. And so, to most people, when they get their vitamin D results, they're going to be too low, okay? But if you happen to be one of these people that you get your vitamin D level and it's above the average or above the optimal range, don't feel like a sense of panic, but this is feedback that then you can act accordingly on. All right, I hope that's helpful. You guys have a great day. Please let me know your questions or comments.